Hello, I'm Dr. Kit Healy. I'm a licensed psychologist in the state of Pennsylvania, and I am a full-time professor in psychology, both for undergraduate and graduate students. And I have a clinical practice that I've had for quite some time. And one of the things that I've often found is that psychotherapy and psychopharmacological interventions are wonderful, but unfortunately they're not the full answer for people. And so I've always been looking for other things that could complement those methods. And for the last decade or so, I've been doing neurofeedback, which is a form of biofeedback, specifically training brainwave activity. And there are a number of different, more maladaptive patterns of brain activity, certainly things like more extreme, like epilepsy or panic disorder, and then attention deficit. And there are different subtypes, as most clinicians are aware of, in terms of attention deficit disorder. But a frequent pattern in terms of brain activity is that the brain is producing too much slower brainwave activity, and it's not often a good match, particularly for the educational environment. And so the inattentiveness is often very high. And so you can intervene clearly with medication and cognitive behavioral techniques, but you can also work to help the brain re-regulate itself. So I work with adults and children who have attention deficit problems. I work also with the full autism Asperger's spectrum, and I work with people who have epilepsy that is often not well managed with medications. And the reason why people seek me out, or other people who are doing this kind of work, is that it is an alternative to medication, or it can be a complement to medication. And certainly there are parents that often would prefer that their young children not start on a medication that may be a lifelong medication, if there would be a way to have the brain trained to then self-regulate in a more effective way. So some of the children I've worked with who had school failure, who are frequently in trouble with the authorities of the school, they were able to self-regulate it better, have stronger executive functioning, were able to manage themselves at a different level with clear-cut changes in brainwave patterns. And so it's rather exciting, and I think it has a place in the treatment process. As clinicians, or people who would want to work with clinicians, it is an extensive training process. It should be done by a skilled mental health professional, and it is also very equipment driven, because you're using computers and you're using amplifiers to detect brainwave activity. So it's EEG information. You're getting that information, and you're using that information to reward or inhibit the activity that you